Afternoon, colleagues, and for those that are dialing in, hello later. I'm Adam Doyle. I'm the Chief Executive of NHS Sussex, so I lead the Integrated Care Board here, but I'm also the National Director for System Development as part of my role with NHS England. So I've got sort of two hats that I'm wearing today. What I thought I would do is outline a bit of a history of my health and care system that I work within, both in terms of the history of it and how we've worked together to improve things, and then to give a specific example about some of them actually that we've got in terms of the evidence and data by which we've done that. So I've worked in the Sussex Health and Care System for just over 7 years, and when I was asked to go and lead that part of the NHS, it was not a system where anybody really wanted to sort of go and work, to be honest with you, because it was known to have a number of problems, which were predominantly, when you look at a purely health context, very much in the space of performance problems, quality problems, financial problems, governance problems. I like a challenge, so I thought I'd take it on. And when I did my due diligence for the role and understood what I thought the context was going to be and what was needed, but when I got there, I also started working there during the Southern Rail strike and lived in London, so it wasn't very good for my home life and my first year of my marriage. But that's a whole other story we won't go into just at the moment. But what I found two key features of that system that made me feel it was possible to help coordinate a leadership model that was different. The first, there were great people working with their communities, like amazing. The people wanted to do the right thing. People wanted to integrate services, people wanted to work together. But the system had found itself from a leadership context to only go into win-lose for everything, both from a commissioning context with each other, from an NHS provider context with each other, and also in working with local government and sort of wider non-statutory partners. So it was pretty tricky. And the sort of the leadership challenge I had was, how do you start to get improvement when everything is a little bit broken and nobody really wants to speak well of each other? And, you know, in terms of, you know, examples, our local authority would not join a health meeting. They just wouldn't come. They refused to be there. Our commissioning organisations didn't speak well of each other. They were very rivalrous. And our NHS provider organisations in that context sort of thought success was really them doing well at sort of, because that's how they were going to survive. So, but of course, all of that was pointing to quality problems, particularly patient safety issues, performance issues, and the money was going in the wrong direction. And we were, on my second week, there was a thing, for those who've been around the health and care system in England for a long time, that was the month that the STPs were rated. And unbeknownst to me, mine was rated the second bottom in the country. And I'll be honest with you, I feel a bit bad for the one at the bottom, because I think we were a little bit worse, but that's okay. I'll take that moniker. So there's many ways to go about that, and many parts of that I got wrong. But the key part that I realised very early on was most of the leaders had suffered a form of moral injury with each other, and their organisations had it, and they felt injury from everywhere. So therefore had closed themselves down, and wouldn't speak well particularly of each other, but also wouldn't confront an issue either. So the journey that I've been on with them all, and you know, and it's a journey that they have led and that they have managed a remarkable thing with their organisations, and we've seen changes of leadership along the way. But the first piece of my learning with this was the honest conversation is the courageous conversation. And how you have that in a way that starts to get people to connect to you as a person is really key. So I'm a behaviourist, but also I'm an extrovert that likes to be around people. But recognising all the different leadership traits that were exhibited in the room, I learned the way to somehow unlock it all was to be really, really to go to where they were, really. So some people with me need a glass of wine, some people need a structured meeting, some need a walk. The leaders were all different and their teams were so different. So the first bit I realized was to get them to start to collaborate, which was going to be the only route out of the kind of pickle they'd found themselves in and I was now part of, was to first of all get people to speak really well of each other and to start to challenge when that didn't happen and to have a really courageous conversation. And then you're like, oh wow, I've got to keep gardening this for like 3 years. So that's the key part. Collaboration does not come easily. It's so to get where we got to, it's really hard yards to get there. But my second lesson is, my goodness, holding on to it is even harder, because the world pulls us apart, doesn't it? Everything pulls us apart. So, and I know there's a governance question that I will answer later. But we create barriers too. We create things that mean we can't give of things, and you've got to go back to the human sort of presupposition of, well, why are people doing that? They're normally doing that because they're a bit scared or fearful. So the psychodynamic analysis between you and a human being is part of collaborating, and keeping that core is really, really key. And then once you get there, then you start to go, what could we do? Let's do something really small. And I had to kind of slightly select things that I knew couldn't kind of fail, because I had to get away of people going, look, that was pretty good, wasn't it? And then my third lesson, I've said it, but in a different context, in a leadership role, you have to be able to, in a role that I've got, both in my national and my local role, but particularly my local role, I'd say, you have a job to be a slight umbrella to enable the collaboration to occur. Because I work really closely with my colleagues in NHS England, and the pressure that organisation is under, I think, is managed much better than people say. But things come out at times in silos. So how do we therefore bring it together and make it not a silo for people to collaborate? So the last lesson that I've learned is the communication piece, about how you handle that to therefore keep the narrative together. In terms of global measures for our system, so we had a £500 million deficit at the beginning of this. We're now looking at roughly an opening position of about £30 million for next year. That's in a £4 billion budget. So some finance people would say it's break even, but my board would not. But there we go. But the other key part is, in every key area, we've seen quality improvements in the main areas that were problematic. There are still areas of improvement that my system need to go through, and we're not there yet, but that's really strong. The other key part that we've also seen, though, is if you look at all the staff indices metrics of all the organisations, they've all improved. So that gives you a sense about belonging, gives you a sense about feeling part of an organisation. And then the most important bit is when you look at the patient experiential outcomes, there are still some that I'm not proud of, good grief, but by and large, the ones that were the most problematic have had an improvement trajectory that is pretty significant in terms of any statistical analysis. And I tell people all the time, we would not have done this without the generosity and the trust and the vulnerability that our leaders felt. So that's what took us there. And then lastly, in a system like mine, just under 2 million people, things go wrong, right? And we had a real issue about 6 months ago about numbers of people in the emergency department with mental health conditions. But by going to the way we work together, we've opened that up. We've reduced that by 75%, and we're able to work together going forward. So I suppose my ending of this is, it's an approach. I think it has to work in systems where the governance doesn't align. There's different statutory responsibilities. But if you can get people all in the same place on purpose, you can do some pretty amazing things. So I'm sorry, I probably overtalked, but that's the Irish immigrant in me. I apologise, but there we go. Back to you.